Hello everyone. In this episode, I am going to talk about 5 important things when you take psychiatric medicines. A lot of these people are nowadays approaching psychiatric doctors for their mental health difficulties and they're also getting the medicines. However, they should know these following 5 points when they are taking the psychiatric medicines. Point number 1. Psychiatric medicines takes time to work. Therefore, don't expect improvement immediately. These medicines will take at least 1 or 2 weeks to go inside the brain and start working. Therefore, you will start noticing improvement gradually after 2 weeks or so. Ideally, it will take at least a month for you to notice significant improvement, and sometimes it can take even 2 or 3 months. Without knowing this, people think these medicines are like fever medicines or pain medicines which can bring improvement in 1 or 2 days. But this is not the case. These medicines take time to work. Please be patient and continue taking them. Point number 2. Most medicines have to be taken for weeks or months. Most psychiatric conditions have to be treated for a long time, especially for several weeks or several months. People take treatment for depression when they have low mood. They take treatment for anxiety when they feel tensed and restless. They take treatment for phobias and fear. For all these conditions, you will have to take treatment for weeks to several months. In severe psychiatric disorders, you may have to take medicines for several years. So please remember that most medicines have to be taken in the long term. Point number 3. Most of the psychiatric medicines are not addictive in nature. When I mentioned that they have to be taken in the long term, you may get worried whether they have addictive potential. But most of them do not have. Only a very few of them have addictive potential. These tablets correct the chemical changes inside the brain. Therefore, they are necessary for you. They are not addictive in nature. There are very few medicines which have addictive potential, and this can be reduced and stopped after few weeks or months following discussion with your doctors. However, most of them are not addictive in nature and it can be taken in the long term. Point number 4. Psychiatric medicines should not be stopped suddenly. A lot of people make this mistake. They either don't purchase the medicines, or when they're going away from home, they don't take the medicines. These things can happen. If you don't take medicines suddenly for few days, it can give you discontinuation symptoms and can create a lot of problems for you. Some of the common discontinuation symptoms are nausea, vomiting, headache, sleeplessness, restlessness, etc. All these are discontinuation problems which can occur if you suddenly stop taking the medicines. Point number 5. These medicines can be taken when you have other health related problems. For example, people may have diabetes, high blood pressure, high cholesterol, arthritis problems, etc. So, when you're taking psychiatric medicines, you can also take other medicines along with it. Similarly, when you have fever or some infections and when you see your local doctor, don't stop the psychiatric medicines during this time. You can still continue your medicines as usual. If you are in doubt, you can also probably check with your psychiatric doctor, and in most of the situations, you do not have to stop the psychiatric medications. I hope that these 5 important tips and information is very helpful for you. Thank you for watching.